Hello, and welcome back to another episode of IgG4-RD Life. And we're your co-hosts. I'm Alex.
I'm Mahsa.
Yeah, and we have another exciting episode for you today. And first of all, I also wanted to say that this is our 1 year anniversary, or almost 1 year anniversary of meeting. And also, it's the first time we're meeting in person since then. We've
Yep.
only been remote. So we're also drinking wine, so pardon the sips when they happen.
Cheers.
Cheers.
And today we're actually talking to our fellow patient, Kim, who is going to also be taking a little sip of wine with us. Kim is not just a fellow active patient and warrior, but she's also a registered nurse, and she's been advocating for our patient community for quite a while now. I mean, since our diagnosis, I feel like we've all been advocating because that's how we are able to help ourselves is by helping others. Yeah, so Kim, welcome
Yeah.
and cheers.
Yes, cheers.
You so much, Alex and Masa, for having me. I've been enjoying watching your guys' podcast, and it's awesome to finally get to be a part of it. So I was diagnosed with IgG4 related disease the end of May 2023. Um, it took about 6 weeks from an acute onset of illness to my diagnosis. And I'll tell you a little bit about how we came to the diagnosis of IgG4. As Masa mentioned earlier, I am a registered nurse. I work as a flight nurse. So my schedule is very similar to a firefighter's. We're at a crew house for 24 hours and we're essentially on call. So if we get a call, we go. If we don't, we stay. I had gotten to work at the beginning of April on one of my shifts and did my normal kind of morning checkoff routine stuff. Took a nap because I drive 2 hours to get to work, and woke up from my nap with a acute onset of abdominal pain. Felt kind of like cramping. My immediate thought was maybe food poisoning. I proceeded to hang out at work, trying to see if I was going to feel any better. And my symptoms just continued to progress. I ended up with nausea and vomiting. And if you know anything about being on a helicopter or in the air, it can cause air sickness. So the last thing I wanted to do was be sick when I'm having to go take care of a patient. So I ended up driving the 2 hours home from work, which normally takes me 2 hours, but took me 3 this time, because I had to stop along the way to be sick, unfortunately. Um, when I finally made it home, my wife had gotten all of the like nausea, vomiting home remedies for me. I had ginger ale, I had saltine crackers. I mean, anything you could think of that you can try over the counter, my wife had available to me. And I spent probably the next 4 or so hours trying to manage my symptoms at home. And I just got to a point where I knew something was wrong. At that point, my wife took me to the small local ER in our town. And through a CT scan, I was diagnosed with a bowel obstruction that was caused by a 5 by 7 centimeter mass. Um, I also had what they called free fluid by my liver. So they were questioning to see if I had had any trauma recently. I had had any falls, anything that maybe had hit my abdomen that would have caused this. While I was in the ER, I had a CT scan done that showed that I had a bowel obstruction caused by a mass. Um, they also saw that I had small masses throughout my abdomen and pelvis. So immediately they consulted with a local teaching hospital in Portland, and referred me to their gynecologists, oncologists. I also saw the local in-house oncologist, believing that I had ovarian cancer that was metastatic. I was admitted to the hospital pending a CT guided biopsy of the mass in my abdomen per the recommendation of the gynecologist oncologist at the local teaching hospital. After about a day and a half of being admitted, I was taken down for my procedure. They put me through the CT scanner just to make sure nothing had changed. And that's when they noticed that the mass had actually perforated my bowel. So I was taken emergently to the OR. Not only did they remove the mass, but they had to remove 12 inches of necrotic small bowel. While I was in the OR, I had gone into septic shock, which required some heavy duty medications to keep my blood pressure up, which is why I ended up spending 2 days in the ICU. In total, I was in the hospital for a week because after a perfed bowel, they need to give you IV antibiotics to make sure there's no secondary infection that happens. So I was in the hospital for a week before I was discharged. Once I was discharged, I ended up with left lower lobe pneumonia post-op, which was unfortunate. I was actually visiting my parents up in Washington with my wife, and when we came back home, I spiked super high fevers of like 104, 105 that I could control with Tylenol, but as soon as it would wear off, they would come back. So we took me back to the ER. Fortunately, I wasn't having any sort of abdominal complication. It was just unfortunately pneumonia, which is common when you spend a week in the hospital. After recovering from the pneumonia, I was first seen by the local oncologist in her office to discuss biopsy results from the mass that they had removed from my abdomen. Surprisingly, it was found to be non-malignant. That's when I subsequently had to make an appointment with the gynecologist oncologist up in Portland. It was probably about 2 weeks from when I saw the local oncologist until I went and saw the oncologist in Portland. When I went to that appointment, although they had seen the initial pathology report from the mass that had been removed in my abdomen, they said my imaging, the CT scans that I had done, were basically, they said that, yep, this looks like exactly like metastatic ovarian cancer. However, since my mass had been biopsied at an outside facility, they wanted to do a second biopsy of a different mass. So I was scheduled for an ultrasound guided biopsy that I had completed, I believe it was about a week later. Fortunately, they were able to get the results back from this fairly quickly. And similarly to my first biopsy, the second one came back non-malignant as well. The only difference was the pathologist at the hospital in Portland re-examined the initial biopsy from the mass and also compared it to the second biopsy that they had taken. And he was I don't know, he or she, but they were actually the one that made the diagnosis of IgG4 related disease. And this was after my case had gone to the tumor board with the gynecologist oncologist department to discuss exactly what they thought was going on. So it was a combination of the pathologist finding and my case going to the tumor board that ultimately diagnosed me with IgG4 related disease. Since then, I had started out on a prednisone taper that I did over 3 months. And I was also started on azathioprine or Imuron. My rheumatologist had explained that although rituximab is the gold standard treatment, most insurance companies won't just jump right to that infusion. They want to try the least or the lesser costing alternatives first. So I was on 3 months of prednisone in combination with the Imuron. After my prednisone taper ended, I was miserable. I didn't know that coming off of the prednisone was going to be so rough. I had no idea kind of what to expect. I just followed the doctor's taper instructions, and it wasn't until I was off of it that I actually had pretty severe joint pain, really bad fatigue, brain fog, just overall felt like garbage, unfortunately. Um, I ended my prednisone taper in September, and my next rheumatology appointment wasn't until November. So I just kind of gutted out the symptoms I was having. The doctor had told me that it can take up to 12 weeks for the Imuron to start taking effect. So I was still kind of within that window. So I just hung on and made it to that next appointment. And with the symptoms I was having and my IgG4 serum levels not coming down, my rheumatologist made the decision to start me on Rituxan. Since then, I had an infusion, my first one in December of 2023, and my second one was subsequently in June of 2024. And in between those 6 months, I did have symptom improvement, which was great. However, at about the 4-month mark from my first infusion is when my symptoms really started to come back. I actually missed a bunch of work as a result of it. And it was that in combination with, again, my IgG4 serum level not really changing a whole lot, that my rheumatologist decided, let's try you on the every 4-month infusion schedule. So I actually just had my 4-month infusion on September 30th and then October 15th. And I am feeling great now. It's been definitely different getting the infusions 4 months apart versus 6. I'm not going to go into the details right now, but I'm sure we can touch on that a little bit later. And that's kind of where I am right now. So currently receiving Rituxan, not on any steroids, only on supplements because I am chronically anemic. So that's another fun thing.
Okay. I just want to say, wow, wow. Thank you so much for sharing this with us. I am certain that other patients who hear your journey are going to feel a lot of resonance with what you've shared. It's so important for us to connect in these ways. I do have a question, and that would be with the first question, mostly because it seems like people who are having flares and relapses way before the 6-month mark, versus people who aren't having flares and relapses at the 6-month mark. So how did you get that kind of approval
Or rather, like,
for 4 months?
yeah,
For the 4-month
yeah,
approval,
because
it's hard enough for
the
6.
4-month increment has been really hard to fight for, and I do know that a lot of doctors like have more power over this when it comes to their appeals. I don't know whether it's their experience or whatnot, but I do know that it does vary by state. So even my rheumatologist told me that the most we could fight and appeal for your case would be the 4 months, not 3 months, because there are patients getting it every 3 months too.
Oh, wow.
He was like, it would be for California 4 months, but insurances have approved that maybe a handful of times, is what he told me. So, that is a little bit defeating, which is why it made me go the Dupixent route, adding a different biologic, a different,
Interesting.
injection to my treatment.
Yes, but back to the question is how did you
How did
manage
you-
to get that
Yes.
approval with your insurance
Thank you.
company? Yes.
To answer your question, Alex, that's a really great one. And unfortunately, I don't know the answer. My rheumatologist was the one who submitted everything to insurance for my initial Rituxan infusions, and then subsequently the request to do every 4 months. At my next appointment with her in November, that is one of the questions I'm going to ask her, to see if she has any tips, tricks, if she could provide me with the paperwork so that we can see if there's any specific language she used, I don't know what we might be looking for, but just to see if there's anything that I can provide as insights to other patients who are looking for insurance approval for the 4-month infusions. The only thing that I can think of, because Mahsa had mentioned it, as some providers are able to get things approved easier than others. My doctor, her name is Elena Getty. She works out of Oregon Health Science University in Portland, or how I know it, OHSU. She's actually done some clinical trial work with Dr. Stone. So I think having Dr. Stone associated with her maybe gives her a one-up in some way for insurance approval, but that's a question I'm going to ask her so that hopefully I can provide some information for other patients.
Thank you for answering that. I appreciate it. And that brought up another one, actually two. But firstly, I think this is going to be something that other patients could really benefit from, is knowing which professional on your medical team is the one that leads or
Yeah.
paves the way for your infusions. Mine is my hematology oncologist, even though I don't have cancer. What is yours?
It's actually my rheumatologist who prescribes the Rituxan for me. She does all of, obviously, the lab work, orders the pre-meds, things like that. I just got hooked into a PCP within the same network and had to fill her in on all of this. So I know for sure it's not my PCP that's ordering it.
So I actually wanted to mention something, because so me and Alex, we continuously mention on our podcasts and throughout our patient journeys that me and her are seronegative, which means our blood work is negative. This does impact our insurance approvals or our appeals for our infusions and our treatments, because it's harder to track, right? So Kim, you actually are a seropositive patient. We didn't get to really discuss that. Do you want to get into that a little bit? Tell us about being seropositive and what that means.
So interestingly enough, I am seropositive, which means that I do show elevated levels of IgG4. My initial level was not as high as I've seen some other people's. I was in the 300s, and the parameters that my particular rheumatologist uses for normal is anything under 125. So I was double normal by their standards. As far as I know, have not been in remission yet. We have not gotten my IgG4 level within normal. I have bounced around. I've kind of come down and then gone back up and then come down more. I kind of live right around 200 to 250, which is, again, another reason why we wanted to increase the frequency to 4 months. So unfortunately, I don't have a lot of information just yet as far as when I'm flaring, when I'm not, based on my IgG4 levels. A lot of it is still symptoms and physical exam for me as well.
say something. I wonder how many people have this disease attack the site of their surgery, because mine sure as hell did. And you alluded to that at some point when you were sharing your journey about how you had your body reacted to the surgery in some way that kind of made it worse instead of better, right? Can you speak a little bit about that?
Yeah, Alex, that's a great question. So I had obviously a bowel obstruction, and what ended up happening, the way that they explained it is there was a mass that strangulated my bowel and caused it to die. So when that happens, it releases a lot, like you get infection, it releases a lot of nasty organisms and things that shouldn't be in your abdomen. And when that happens, it basically can cause sepsis, which is just a really, really bad infection that actually significantly can alter your blood pressure to be really low, makes your heart rate really high. And so when they took me to the OR and opened up my belly and they found that necrotic tissue, my blood pressure dropped, my heart rate spiked. They had to give me some medications to assist with getting my blood pressure right and things like that. Um, so I don't know if in my case, it might have been more so the infection that was going on and not necessarily the IgG4 that made my particular situation worse.
Thank you. That's that's a common question we all have, even with me, because I had, that injury to the face that started a whole ENT infection. But again, ENT infections was something I was commonly dealing with. So it's like, were the infections commonly happening because I had IgG4, or did that final, ENT infection just kapow, wake up, my IgG4? Like, did the chicken lay the egg?
or did the biopsy trigger
Oh,
this response?
oh,
But anyway, I'm gonna move to another topic, which would be, earlier I said that the person who does my Rituxan infusions, and who does them, who orders them, who is like the saint of, she's a saint, she's an absolute saint. Oh my God, I love her so much. But anyway, in any event, she's a hematologist oncologist. And which brings me back to cancer, because pretty much all of us on our journeys, along the way, the stepping stones across one of those rivers is the cancer stones, right? So we all end up having an oncologist on our team. So we talk about how IgG4-RD, it represents as fibrotic masses in like glands and organs. You were talking about the tumor board, right? Because that's a tumor, right? A fibrotic mass. Am I wrong? I have no idea. Can you talk a little bit, at least from your knowledge of being in the field, what's the difference between a fibrotic mass and a tumor?
Alex, you're getting me way out of my wheelhouse. For me, the way that I've kind of learned to explain it, so I have IgG4 related disease, but underneath that, I have sclerosing mesenteritis and retroperitoneal fibrosis. So that's just basically fancy words for the fibrotic masses that I have in my abdomen and pelvis. And the way I explain it to people is that at some point in time, my immune system had some sort of an insult to it, whether it was a cold, whether it was some sort of illness. I mean, some sort of insult that had to heighten my immune response. And unfortunately, after that illness passed, my immune system continued to just stay kind of in overdrive. And from what I understand, produce these tiny little masses that over time become kind of encased with a scar tissue. So they most likely will not shrink or go away. They are chronic. And on my CT scan that I had most recently in July, we were able to see that no new masses had grown, but the ones that were in my abdomen and pelvis were all still there and all the same size. So I have chronic masses that won't go away. And that's kind of how I explain it to people, if that makes sense.
Yes. I also have those that, and I actually want to ask you something. How do you get the scans? How often before the infusions and after to see the change?
I
Oh my
had
goodness.
a CT scan incidentally done before my infusion in December of 2023. I had a weird kind of episode of abdominal pain, nausea, vomiting, and I freaked out because I thought I was having a bowel obstruction again. So I went to the ER and they did a CT scan that showed no obstruction, and my disease was a little bit progressed in December of 23 compared to May of 23. I had a new mass on my left ovary, and I think that was the most significant one that they found. So fast forward, I had an infusion in December of 2023 and my second one in June of 2024, and then a repeat CT scan in July of 24. So I had one complete round of infusions and had just been reinfused about a month prior to my CT scan. So right now, I believe I'm on every kind of 6-month schedule, but it varies depending on my physical exam, my symptoms, and my blood work.
Thank you so much. That was incredibly helpful. I hope it's as helpful to everyone else as it has been for me with my complicated question. I do have another question, and that was for people who are like early in their journey, or perhaps people who are curious that this may be what they have, right? Because we get a lot of those in our groups, because you're in our groups too, that are like, I think I might have this, I don't know. And that's like people who have multiple different types of cancer diagnoses, metastasis, right? Where we're having these masses, whatever you want to call them, and they're like showing up all over the place in all these different organs or glands, right? Shoot, you're metastasizing, but you're not, because you don't have cancer. What was that journey like? Or that portion?
Finding out that my disease was progressing put me right back to when I was going through the diagnosis process. We were discussing doing an additional biopsy to rule out that this was cancer again. It just honestly sent me into a downward spiral. I thought I had like kind of face down my own mortality once, and I was having to do it again after being on treatment. It was really, really defeating and a pretty dark time. But fortunately, we were able to um, get me on the infusion, and my rheumatologist decided that let's not biopsy anything, because the problem that we have with my disease is going in and doing a biopsy of a mass on my uterus or near my ovaries just has the potential to cause even more scar tissue than is already in my abdomen. So the risk benefit was weighed there, and it was decided, let's do the Rituxan infusion and then let's rescan you in 6 months and see how things are looking, and we'll go from there.
Why 6 and not 4 or 3, actually? Like, you know what I mean? Like, okay, so a lot of people get false negatives because they're already on prednisone, or they're already on rituximab, or they're on Cellcept or whatever. Why wait until you're at the very end of the benefit of the infusion?
That's a great question. That was my rheumatologist's choice.
Sorry.
So I'll speak to that a little bit on my own experience, which is that I personally get scans, biopsies, and anything that of significant. I make sure I schedule them before my infusions, and I mean like within a month before my infusions, because I know I'll be in my relapse. And when I'm in my relapse is when everything's gonna be acting up and acting worse. So I rather do it then. What kind of halted me this last, right now when I'm in relapse right now is that I had to up my prednisone again. I had to up my steroids, and once you do that, the scans aren't going to be as accurate. But I also did so I would get all my scans and testing, but if there has to be more biopsies, I do it within the 4 weeks before, but not less than 2 weeks before infusions, because you don't want to risk getting any infections or anything. But I always do it because I know I'll be in relapse. So I know that the chance of that organ or that symptom acting up is going to be more in my relapse. And that'll be like the best way for them to catch it. Because with IgG4 being invisible and random, and it popping up at any random occasion, we know it's hard to track it, because by the time we get to our appointment, because they always schedule us, even the stat
Months.
orders months out, and when you go to the ER, they're like, you're not dying, go back home. So, it's like that kind of situation. So, you kind of want to start planning these things out like this, where it's like, and all of this comes back to tracking, right? So tracking every day helps like me tracking for the last 2.5, 3 years. Now I know when my relapses are, and I know when to schedule my scans and my tests, like specific ones, that I want to keep an eye on.
Well, okay, and this is not exactly a segue into anything, so maybe I'm changing the subject, but it definitely goes back to something that you were saying, and it touches a little bit on what you're saying, even though it doesn't seem to, and that's the subject of mental health.
Oh,
Okay.
it does.
Because all of this really messes with your head. All of this messes with your head. Period. Not, and I don't mean like your melon, like brain involvement, which I have. I mean psychologically, it's like, yay, shoot. And what you were just talking about, your experience, where it was like very much a yay, oh crap kind of experience. And so I have a two-pronged question for you. One being, or three-pronged, make it three-pronged, sorry. One being, what's your mental health journey been like? Two, how has the group sessions helped you? And three, based on your own personal experience, not some, grand design experience, what would you have to say to patients and their caregivers about this whole mental health experience, which is a whole additional thing to add to this disease. It's not just physical. There's a whole lot of stuff that goes on.
Again, Alex, you have such great questions. My mental health journey throughout this process was a roller coaster initially. I fortunately am someone who has been in counseling for a really long time. Just it's something I wanted to do. Started doing it in my 20s and have maintained into my late 30s. So I actually already had a counselor when I was diagnosed. And at the time, I was only going once a month, kind of maintenance, no big things going on in life. And once I was diagnosed, I was going almost weekly for a good 2 months. My wife and I had previously seen a couples counselor, just again, not any big things going on in life, but we knew we wanted to get married. We knew we had some communication differences. And so before kind of tying the knot, we wanted to really put in some effort to work on our relationship. And we had graduated from couples counseling, but when I was going through the diagnosis process, we contacted our counselor and started going twice a month just to try and navigate the heaviness that came with being 35 and facing a terminal illness. It was really, really tough. Just constant peaks and valleys, good days, bad days mentally, on top of recovering from a really extensive abdominal surgery. So there were a lot of different things that were playing into my mental health journey. But I fortunately have a really good support system. My parents live a 4-hour drive away. I've got good friends that live close by, and obviously my wife. So I really leaned heavily into them despite wanting to take care of myself, essentially. So I was really lucky in that way. Additionally, getting hooked up with the IgG4 community on Facebook, and subsequently the IgG Forward community, as well as the IgG Connect community, really helped validate the kind of crazy emotions I was having and allowed me to connect with people who knew exactly what I was going through, unfortunately. And what was really helpful were the sessions with Dr. Al. Even just being in a Zoom room with other people sharing their experiences, listening to other people's similarities to what I had been through, and knowing that I wasn't alone was a huge, huge relief for me. So those sessions, I love them. I attend when I can, as long as I'm not riding around in a helicopter at work. And then just to touch on your third question regarding mental health, the biggest thing that I can say to anyone that's either going through the diagnosis process, newly diagnosed, the emotions you're going to feel are real. They're normal. They're not necessarily going to be sunshines and flowers and rainbows all of the time. You're going to have the hard days. And the best piece of advice that I can offer is talk to someone. Whether you need to talk to yourself in the mirror about how you're feeling, whether you need, before you can feel comfortable enough to talk to someone else, reach out to a friend, family member, I mean, anyone who you feel comfortable enough to be vulnerable with, and start the conversation. That's the hardest part. But the nice thing is, there are so many of us going through this. There's a wonderful community out there, and we are all here for each other.
Wow, thank you. Thank you so much. Yes, you can reach out to us. You can reach out to the communities already that Kim has mentioned, the IgG4-RD or related disease Facebook community, the IgG4-RD Connect community, the IgG Forward community. I
and
would say,
reconnect.
I know that in a previous podcast, I listed in the show
Yeah.
notes all the
We'll
communities
do
that
it
we
again.
know of, and we'll put this back in these show notes as well. But the point being is connect with all the IgG4-RD communities, because they will all have a different slant. They will all have a different take, and people come from a different place.
And different
And if
sources.
you can't get help from them, you can give help to others who are in them. Because part of the healing process is helping others. Sorry.
And all you can do is and literally, like, the easiest way to help others is by just speaking up, sharing your story, because speaking up not only saves your own life, it will save others' lives as well. Because until you don't speak up, nobody else knows that there's more people going through the same situation. Your doctors won't know what to look for, what to test for. A lot of times it's a cultural thing. Like for me, it was cultural that I wouldn't speak about what was really going on. I would filter what I would say to my doctors, and that hurt me over the years. I mean, I know our disease is so rare and it was already hard to diagnose, but then also coming from this type of cultural background, I was like also affecting, how I was gonna get diagnosed, so speaking up, speak out. Right, so Kim, you mentioned that you've had a therapist well over years, decades. So have I, and so has she. And when you talked about it, kind of made me think about when I showed up to the symposium and I was told that it's because women care more about their health and we are more known to be caregivers. And this is why we show up to events, and this is why we show up to support groups.
Oh, and this is why more women are in the online sport.
Yes, this is why it's that. Whereas we know firsthand that we are more female patients. How do you feel about that narrative that keeps getting put out there about older white males?
So you're talking about health, equity, and research.
Well, that's the thing, right? So how do you feel about that?
I was really surprised when I first researched IgG4 related disease because I had never heard of it before. I mean, as a nurse myself, I'm mainly trained in emergency medicine and critical care. So I'm not familiar with a lot of uncommon or rare diseases, let alone like rare autoimmune diseases. And I was very surprised when I did my research initially and found out that this was a common ailment of 50-year-old white men or older than 50 white men. It was especially curious to me when I joined the support groups that it seemed to be predominantly female. However, kind of like Mahsa said, there's a lot of good research that shows that females tend to be the caregivers, be the ones who are seeking out support in groups. I think a lot of times because there's not the stigma that's attached with males seeking support or help in a way that females do. So it was also really curious that a lot of the support group members were female as well. And it begs the question, if there's so many of us, why isn't there more research equity like Alex had mentioned? And in attending various like webinars and listening to professionals speak about this, what I've learned is that most of the time IgG4 disease manifests in single organ systems with males compared to multi-organ systems with females. And additionally, females tend to have multiple autoimmune diseases or multiple diagnoses, whereas males oftentimes will only have a single diagnosis. So when it comes to research, I understand that being able to take male patients who have the disease isolated to one system and they have only IgG4, their data is going to come out a lot different than looking at a female who may have multiple diagnoses, also various different hormones running through our bodies. But I don't think it's an excuse. I don't think that it's an excuse to not do research on females. They need to figure out a system that allows for participation and research, more research to be done on females, because this is obviously affecting us as well.
We like to end our session with our sessions with our messages to patients, caregivers, and medical personnel. First, we're going to start with Kim. Kim, what would you say to these groups?
Oh, that's tough. That is a tough one. I think the biggest thing for me is that, especially to the patients and caregivers, and even the medical personnel who are trying to navigate this rare disease, the treatment of it, the diagnosis of it, you're not alone. There's so many or so few of us going through it, but there's a community out there, whether it's patients wanting to connect to patients, caregivers wanting to connect to caregivers, or even medical personnel seeking resources. It's out there, and we're not alone in this.
Thank you, Kim. Mahsa, what's your message?
My message almost always remains the same. And after our last session with Lindsay, I feel like I can't top her message to our patient community, but I will try to do the best I can, which is join any community that you can. And we always share them in our comment section, in our description section. So please join all of the communities that you can, even if you're a family member, a caregiver, because it could help you identify something in your loved one even. And so join all the communities that you can. Patients, speak out, speak up, speak out loud. Yell to the top of your lungs, whatever's going on. Listen to your body. Doctors, listen to your patients. Always. Caregivers, love you and thank you. Alex?
Thank you. Yeah. So I would like to add to this group of people who are on their journey to diagnosis. So they're not technically patients yet. And if you have stumbled upon us, I would like to say to you, stay curious and make sure your doctors stay curious. Reach out to your community. We do have an idea what it's like. We may not know exactly what you're going through because everyone's experience is different. But, and one thing is the same. We have the same frustrations. We have the same sort of path to journey to diagnosis, path of journey post-diagnosis.
Same roadblocks.
We've got the same roadblocks. We've got doctors, some doctors who gaslight us. We have some doctors who support us. The most important thing is not just finding doctors who know anything about IgG4-RD, but more important than that is a doctor who is curious, which leads me to caregivers. Burnout is real. So if you're burning out, acknowledge that and don't feel crappy for it. Take care of yourself. Okay?
Self-care.
Yeah, take care of yourself. And actually, patients, take care of yourselves too. And it's not just bubble baths, but therapy, group therapy, join the groups, join everything. Caregivers, join the groups, join the everything. Both of you. And that brings me to the medical
Doctors.
community,
Oh boy.
which would be stay curious. And I am very, very, very lucky to live in a city where
You have
I
those
have
doctors.
Stanford, I have San Francisco, UCSF. I have all these people. They're so curious. They're so hungry for more. I'm so lucky. And that is what I want for all of you patients. So
I
back
have
to
to
you
s-
patients. I want
this is
all of you
amazing.
patients to have what I have, because the
Yes.
sooner you are diagnosed, the sooner you are treated, the sooner you are cared for, the sooner you feel cared for, the sooner you start to get better. And that's what I want. And that's why I'm doing this. And I just want to send love to all of you.
And so thank you, Alex. I love you. Thank you, Kim. We love you.
We love you. I love
Yes.
you.
This
Yes, we
is-
like to we love to end our little sessions with I love you.
Love you guys. Thanks for having me on. This was a great conversation.
Love the love. Thank you.
Love you.
All right.
Everybody else, follow, like, subscribe so that we can keep you posted with all
Share.
things IgG4. Yes, please share. And then listen, because then you could share even more. Yes, love you.
Just-
Bye.
Okay, bye. Wait, X done. We're done.
We're gonna have